So I had a laparoscopic appendectomy December 14th, 2018.
Okay.
So after that, I couldn't be in the gym, so I started walking around like this, started working out with a weak core. I went to 2 8-week sessions at Advent Health Med and Rehab to kind of get that core strengthened up again.
Okay.
And I didn't really do anything, so when I work out, I still have a lot of back pain on my right side, right
Okay.
here. And I'll find, like, if I'm doing a squat or something, I'll kind of twist and do a lot of this and push out.
Are you pulling away from the pain, or it just naturally does that?
It just naturally does that.
Okay. What was the surgery for?
Appendicitis.
Oh, did it burst?
No, thank God.
Okay, awesome. Have you had any tingling down the legs at all?
No, but sometimes I feel the sciatic nerve, sometimes inflamed, but it goes away pretty quickly.
Is it local? Like when you feel that sciatic nerve become inflamed, is it local to that one spot, or does it move at all?
Nope, it's just in the buttocks.
Okay, let's go down. Let's check you out. Let's check a couple things out. Let's poke around. Let's go face down first. And point to the spot that hurts you the most. Is it only on that right side, or does it move at all?
Usually it's only on this right side.
Okay,
Always.
let me just see if we have any discoloration here. Okay, go ahead and relax your head. Just try to let all the muscles go that you don't need to let. You can put your arms right up here on the rest. Right there. Good. All right, I'm going to hit some spots here. Okay, is this the spot here?
Yes, right there.
How about this one?
Not as much, but it can hurt right there.
Okay.
Yeah, right where your thumb
Yeah, I
is.
feel that one. Okay. Okay, we're going to hit both of them together. Anything on this one?
Which side?
On the left right here?
Nope.
How about if I go under the muscle right there?
Right there. Yep.
If I go through the muscle?
Yep.
All right, how about this high up into the sheath?
Not as much up there.
Okay, how about here?
Nope.
All right, keep this knee straight and let this leg off the table. Oh, this one. Okay, good. Let me see this one. We're going to try to go the same height. Higher if you can. Okay, let's go back to this one. This one seems higher. Okay, is that as high as it goes?
I can go higher,
Yeah.
but I feel like...
Does it hurt when you go up here?
I feel when I do it this way, I can feel like the resistance up
On
here.
the right?
Yeah.
Okay. All right, so this actually does look like a little bit of subluxation, a little bit of misalignment in the vertebra. Did you hurt this before the surgery, or you just noticed it after?
I noticed it after, but when I would like do bench press before, if I was arcing a lot, I would feel it kind of, I would just feel the pain down there. I don't know if it was like contracting or
Okay.
whatever it's doing down there, but yeah, I definitely could feel it.
But it wasn't major?
Mm-hmm.
You could feel it before, but it wasn't major?
No.
Okay, sit up and face that way. Face that light, that way. All right, sit up real straight, good posture. And kick that right leg straight out. Did it hurt your back at all?
No.
Okay, let me see that one. That one hurt your back at all?
No, but I can feel like
The pull?
resistance, yeah.
Okay, so let me pull this leg up a little higher. Kick this one up. Does it change? Does it get worse? No change? Okay, good. I'm going to set you up real straight posture. I'm going to push in here. Any pain?
No pain, but I couldn't like sit like this naturally.
What would happen?
It's just it's not comfortable, and after like 10 seconds, I'd have to, go back to a bent over position.
Okay. So you got two issues here. One is you actually have a little bit of a tear in the muscle. You see this here?
Mm-hmm.
And then you actually don't have good movement in the joint. So let's test a couple things here. Let me see you stand out here. I'm going to do this one first here. So you're going to put one hand here on your chest, square off to me so I can see you. And you're going to put one hand on your belt buckle like this. Now keep this arm parallel with mine, and you're just going to try to turn the hips, but keep the upper part still. There you go. Good. Go the other way. So keep the upper part still. Yep. Keep this parallel with me right here, and turn that one that way. Nope. So this one still, and turn the lower. Keep this part still, and just turn the hip. There. Upper part still. There you go. All right. Now go this way. All right, so what you're having a hard time doing is uncoupling. You see how the upper part wants to move with you? So your brain's trying to protect that area here. Let me see you put your hands up. I'll do this one first. Put your feet shoulder width apart, and you're gonna try to squat. And see how my chest is staying in the center? Mm-hmm. And then I come back up. Let me see you do that.
Now this is where I've had people tell me sometimes they see me if I'm going down, I'll kind of do this.
Yeah.
And then push up.
Yeah, so you're pulling away from actually where the damage is, and then the muscle memory pattern is keeping the muscle contracted. But what I want to see on this one, see if you can really do this, because this tells us a lot of what's happening in the low back. See this chest bone stays in the center? All right, I'm old, and I have an old back injury, but I'm going to keep this in the center when I go down. See how it doesn't come forward? If it comes forward, it means that those two lower bones aren't moving normally, so it pushes you forward. So try to keep this in the center. Right there is a collapse. Okay. Okay, come back down. Put your arms back down again. I'm sorry. Put your arms like this again. Try to do this again. Okay, upper part stay still, and let's just turn the lower. There you go, perfect. Now go the other way. Okay, do you feel a lot more resistance going that way?
It's easier this way,
Yeah.
harder this way because of like this area down here.
All right, go on your back, let me see this. Where's the incision?
They did 3, 1 here, belly button, and right here.
Okay, let's just see if there's any scar tissue in here, okay? Just take a few deep breaths in. Let it go. I'm gonna check the psoas too. Bring this leg up, and just breathe normal now. Okay, you feel that? Any pain?
No, but discomfort. And I did have, right after the surgery, I had a lot of bulging on this side.
Okay.
And still to this day, when I cough, you would think I had a hernia. We investigated it, CT, MRI, ultrasound, but nothing came back with anything, so
Okay, let's check the
just kind
diaphragm.
of forgot about it.
Breathe, and let it go. All right, any pain in here? Or just a little tenderness where I'm hitting?
Nope.
Very good, let me see this one, breathe. Bring this leg up. Drop this one. Okay, now do you feel that right there? Is that tender or not bad?
And it's not painful or anything, but I can definitely feel it.
So this is a little bit of spasm in the psoas. It's a good thing you're not fat. Good. You feel that one?
Yeah.
Okay, bear, breathe through it. Good. Let it go. Okay, it's a little. Is that sharp at all?
Not sharp, but I can definitely yeah, it's uncomfortable.
Okay, breathe again. Let it go. Good. 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 And so you actually do have a little bit of visceral scar tissue in here. Let's take a quick picture of it. Let me take a couple more tests on you. Look straight at me here. You roll forward just a little bit, but you got a big chest. So let me see you turn to the right.
And I do have torticollis.
I see that. Well, you had it. You don't really have
I
a.
had it.
Let me see you turn that way. Okay, you feel the restriction going that way?
Yeah, on this side
Yeah.
right here.
All right, look at me again and go up and back. Okay, now that you pull away from too. So look at me here again. And now just lean to the right. That's good, that's normal. Let me see that one. Oh, that really locks. Okay, take a seat. Sit up real straight. Okay, tell me if you feel anything in here. Not bad?
Nope.
Good. 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 You feel that one?
Yeah.
But does it hurt or does it just feel tight?
It's just tight.
Okay. Good. 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 Okay, this actually, did you hurt your neck before? Because you don't have a ton of muscle scar tissue or damage in there.
I haven't had any other injuries.
Oh, there.
When I was a baby, they did a lot of therapy.
What happened when you were a baby?
They found it like 10 days after birth, and then they immediately started stretching me, and pretty much fixed itself from there.
They found the torticollis when you were young?
Yeah.
All right, so a lot of times when you get torticollis as a baby, when they either use vacuum extraction or they use the forceps, they can actually dislodge the top bone. So we'll check that here in just a minute, okay? Okay, you feel that one, or is that just tight?
It's just tight. I can feel the muscle.
You have a little bit of more muscle contraction here and here, but I don't feel any scar tissue. Let's do this. Let's take a couple of pictures and let's see what's going on. Put your arms out to the side. Hold strong. Hold, hold, hold. Good. Put your arms out in front. Hold, hold. Good. All right. Come with me. Let's go take a picture. Let me see this right here. So you can see the scoliosis in here. So it's called a triple harmonic because it's like if you take a slinky and you wave it, where you would see these wave patterns is what the harmonic is. So you got a little tiny one here, 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 and then the low back you actually straighten out pretty well. So this actually doesn't have a wave pattern to it, but you can kind of see it lean just a little bit over, and on a digital x-ray you're actually on the opposite side. So on this right here, what I'm going to work with on you today is I am going to do some work up in here. And on you, this is where this would be. This would be right in this, kind of under the scapula area here. So I'm going to check the mobility in that. And you can see how the ribs slope down and away here and a little higher up on this right side. That's where you get some of that pressure from. But in the low back here, this looks good. The curve looks really good. You have a little bit of a nuclear impression in here, which is that little archway. And that's like if you take a hit and the disc, it impacts up into the bone like this, and it leaves a little bit of a crater like that. If you remember taking a hit or falling on your butt, you got a little bit of a dislocated tailbone too. Remember anything big like that?
No.
Okay, good.
And I never played football or any heavy contact sports either. It's all just bodybuilding.
Bodybuilding, wrestling,
Nope.
off-label fights.
Nope.
Good. That's a good thing about being young and healthy. You are going to keep these though. There's nothing we can do about that. But it does tell me you've had some compression down here, even though this curve is perfect though. So more of what I'm going to work on with you is going to be a little bit more of a muscular release right through here, or actually more right through here on you, is to get this to kind of give way a little bit so you get better mobility. But I don't see a problem in the actual joint, which is usually what we see is more of a problem in the joint or the disc when you have a problem squatting like that. What you can see though on this is how far forward this middle part of your back is going. So when we measure this, we measure from the center part of L3, which is right here, and you typically want this line to be going through about the first third of that bone right there. So again, you're pushing forward here. That puts a little bit of pressure on the muscle, but it shouldn't affect the amount of problems you're having squatting with the movement. So we're going to kind of release that pressure and see what happens with it, and then we're going to work up in here on you today. And I'm going to work on this curve a bit. I'm going to show you some exercise you can do to bring that curve back. All right, so hold these just level to the ground. Let me see you roll them back. Good. And then roll them forward. All the way down. Good. Your mobility's not bad at all. All right. Now take them to your sides. Right here. And go straight up. Okay, good. And come back down to your side. All right, and then come back with your arms like this. All right, and just leave the hips still, and you're just going to turn all the way from the top torso. There you go. All the way turn, and turn all the way the other way. Okay, your range of motion is normal, but symmetrically you're a little bit less going that way. Take a seat and face that way. Let's get some of this cleared out. All right, so put this right arm up and just start going up and down with it. Go straight up with it. Just going to see if we have any spots in here. Any pain with that?
Nope.
Okay, chest up, head up. Good, keep going, good. Good, not bad. Okay, we're going to get a little bit deeper in here now under the scapula here, okay? Okay, now do you feel this rib under my thumb? Come down. It shouldn't be hitting that hard. Does it hurt or you just feel it pressing up against it?
I can just feel it.
Okay, go up again. Keep doing a few movements. Good. All right, and come back down. All right, let's go face down. So your muscles in pretty good shape too. Are you training right now?
Oh yeah, 7 days a week. I haven't taken any days off with all the injuries, which could be bad.
Okay, go ahead and bend this leg up. All right, you're gonna feel me pull this knee up. Contract this muscle just a bit. Any pain with that? Are you good?
Nope.
Good. Is this one of the spots that you're getting?
Yeah, it's right there.
This one's a tough one. Good. I feel your knees popping. Beautiful.
Yeah, this is actually what I'm trying to do sometimes. I'm trying to crack my back, and I use the door to kind of twist. And this is the same motion I'm trying to achieve.
All right, so try not to do that. So when you do that kind of twisting to get a pop, you're using the ligaments to pull the muscle. You see how far I'm pulling you? Mm-hmm. You don't want the ligaments to be doing this much of a pull and then moving a bone. There we go. There's the release we want right there. Any pain? You're good. That's it right there. You feel that?
Yeah.
That's fantastic. This is the spot where you feel like it gets stuck though most of the time?
Yeah, this is the spot I'm trying to, twist or get some relief out of.
Because it feels stuck or it just feels tight?
It just feels tight.
Right, so the main thing I see with you is you have a little bit more of a curve than most people have down here, and it doesn't necessarily mean pain, but it is going to put a lot more stress on these erector muscles down here. Turn on your side, Taylor, and face me. All right, relax your head right there. All right, I'm going to bend this top leg up. I'm going to bring this bottom one forward. All right, I'm just going to get a little bit of movement down to the pelvis here, okay? Take a deep breath in. Let it go all the way. And just let it go, relax. Let it relax. Beautiful. All right, let's go the other way. You good?
Yep.
All right, relax on your hand. Good. Bend this one up. All right. Now this one's gonna be a little higher. Take a deep breath in. We're gonna get right into the joint. Breathe. Let it go all the way. Okay, go on your back. All right, so you get a little locked up in this one. Bring this knee up. Okay, come up with me. And then we're gonna come across, grab this knee, and bring this to that shoulder. There's a stretch. Good, let's see what this one looks like. Bring this one up, and bring this over to that shoulder. Okay, you see the difference in the movement? You're gonna wanna start stretching the piriformis. Flip back over on your belly. Sorry, I know this can be a little bit uncomfortable. Try to let it relax. Oh, these are your hot spots, my man. You feel these?
Yeah.
Okay. So bear with me. This is gonna be a little bit rough. We gotta release these points of the muscle. You're gonna sweat a little bit on this one, okay? If it's too much, let me know, but we're gonna break this up real quick. You good?
Yeah, you're just going to be kind of rowing in there?
Yeah, I'm just gonna break up the scar tissue, just like this
yeah,
right
that's
there.
Cool.
Good. And then this one. Then we're gonna re-stretch it again after this, okay? Feel that one right there?
Yeah.
Okay, we're trying to let this, feel that one right there? What's that on a pain scale on a 1 to 10?
It's not painful, it's just different.
Just different, okay. You can tolerate that then, right?
Yeah.
So that's the piriformis muscle right there. We're trying to release, there it is. Bear
Yeah,
with
I'm
me.
trying to relax it.
So I'm hitting the nerve in that muscle. More of your issue is in the muscle. There you go. Do that again, breathe. Perfect. Woo, that one's hot. You all right? Where's the pain on this one?
No pain, just different.
All right, can you feel the spasm in the muscle when I hit this? Feel the twitching?
Yeah, when I kind of start like squeezing.
Okay, let it relax just like that. Good. There you go. Do that again. Breathe. All right, go on your back one more time. Let's see if we get some movement in there. So more of your issue right now is it's called piriformis syndrome. You're not getting the shooting legs down the back, but these are way over contracted. Okay, let it relax. Let it relax. Good. And bring it across. Beautiful. Let me see this one. Beautiful. So I'm going to recommend you don't have to work. You should still work your core, but your issue is in the piriformis muscles. And I'll show you how to do that stretch here in a second. Let's get the rest of you here. All right, so lock your hands like this and put them on your belly and just let your shoulders relax, all right? Good, really nice. All right, we're just gonna help this, get a little bit more motion in here. Good, perfect. Beautiful, Taylor. You good?
Yep.
All right, cross here. And let's put some ribs in. And this upper part of the scoliosis is gonna feel me roll you just a bit. Breathe, let it go. Beautiful. Well done. One more. Excellent. Okay. All right, come on up. Let me see. All right, stand over here and face me. All right, on this one, we're going to go back to this again. We're going to go here. Come right back up again. Beautiful. Well done. All right, your piriformis, though, is an issue.
And then that's down here?
Yeah, it's firing too much. So the stretch for this, so go ahead and go and lay on your back here. And you should be doing your I would do piriformis stretching, probably just as much as you're doing core. So you're gonna bring the knee straight up, grab it with both hands. So bring it up to this shoulder first, and then take this hand and go over the top, and now bring it over to this shoulder. That's it right there. Feel that? That's the muscle you wanna work on. That's good. Once it releases, you get that motion.
It's right all over here.
Yep, let me see the other one. Pull that one straight up, hit both hands, and then go over the top with this one here, and bring it up that way. There you go. And they move, once you get them released, they move pretty well. That's all you gotta do. Everything else is actually in pretty good shape.